Welcome to AETCM, the Emergency Medicine channel. Today we'll be discussing about Alvarado scoring system. So Alvarado scoring system is a clinical score which is used in assessing the likelihood of appendicitis in patients who are presenting with right lower quadrant pain. So it consists of 8 parameters which are subclassified under signs, symptoms and laboratory findings. We'll go to each in detail. Coming to the signs, so if there is tenderness for the patient in the right lower quadrant, we'll be giving a score of 2. If there is rebound tenderness for the patient, we'll be giving a score of 1. And if there is elevated temperature, that is if it is more than 37 degrees Celsius, we'll be giving a score of 1. Coming to the next, that is symptoms. If the patient is having a pain which is migrating to the right lower quadrant, we'll be giving a score of 1. If there is nausea or vomiting for the patient, we'll be giving a score of 1 again. Or if there is anorexia that is characterized by loss of appetite, we'll be giving a score of 1. Coming to the last, that is the laboratory findings, so under which we have 2 parameters. The first one is leukocytosis. If there is elevated WBC count that is more than 10,000 per cubic millimeter, we'll be giving a score of 2. And if there is neutrophilia for the patient, we'll be giving a score of 1. So it makes a total of 10. Coming to the interpretation, if the total score is between 1 to 4, the patient is very less likely to have appendicitis. If the score is 5 or 6, the patient is at intermediate risk for appendicitis. If the score is 7 or 8, it is probably the patient can have an appendicitis. And if the total score is coming around 9 or 10, it is probably or it is very likely that the patient is having an appendicitis. Thank you for watching.